Well, thanks for connecting to this virtual poster presentation and discussion with a recent AMCP Foundation Best Poster Awardee. I'm pleased to be joined today by Ailsa Watson as she will present her Best Poster information shortly. The AMCP Foundation Best Poster Competition is hosted at AMCP meetings, and we want to thank CVS Health for their generous support of the competition. I'll be your moderator today. My name is Jeff Heater, and I am the AMCP Foundation JRC, or Joint Research Committee member. So you may be asking yourself, what is the Joint Research Committee, or JRC? The Joint Research Committee, or JRC, objective is to promote and encourage the creation and then ultimate dissemination of relevant and credible research with the effort and focus to advance patient care services and managed care pharmacy with the ultimate goal of improving healthcare for all. We do this through three initiatives. The first one being to develop and then update a research agenda, of which that agenda identifies and prioritizes those critical evidentiary gaps as it relates to managed care pharmacy. The second initiative is then to disseminate that research agenda to numerous individuals and organizations with the sole undertaking to advocate for the research initiatives to address those evidentiary gaps. And then finally, to cultivate student and practitioner interest in research. The actual research agenda can be made up and found within 4 pillars. More information can be found at the reference here at the bottom of the slide. Those 4 pillars briefly are real-world evidence, which are used to inform managed care pharmacy decision-making. The second pillar focus more on value-based models as it relates to managed care pharmacy, with the goal of addressing total cost of care. The third pillar is the impact of benefit design or utilization management and the strategies around those and their impact on patient outcomes. And then finally, the impact of direct patient care services that are provided by the managed care pharmacy community, and what are those impacts on patient outcomes. So with that in mind, and like I mentioned, I'm extremely excited to introduce you to Ailsa Watson, who is our most recent Best Poster awardee, and really looking forward to her topic today. And with that, Ailsa, I'll turn it over to you to introduce yourself and tell us more about your research.
Thanks, Jeff. Like you said, my name is Ailsa Watson. I'm a current P4 at Lipscomb University College of Pharmacy, and I'm also a part of the Vanderbilt Specialty Pharmacy Research Program. My project was the assessment of the implementation of collaborative pharmacy practice agreements in an integrated health system specialty pharmacy. A little bit of background on this topic. So collaborative practice agreements within integrated health system specialty pharmacies allow pharmacists to prescribe medications and order labs within their clinics for specialty medication management. We wanted to do this study because there's an unmet need for research in this area. There are a growing number of health systems developing integrated specialty pharmacies that help provide comprehensive specialty medication management, from helping patients access specialty medications to monitoring and optimizing their treatment options. There was a study in 2022 published by ASHP Health System Specialty Pharmacy Practice Clinical Services Survey. And in that study, over half of their 90 respondents had at least one specialty pharmacist operating under a collaborative practice agreement. So this really shows that many health systems are already implementing CPAs, but there isn't a lot of research to back it up. So while we could find a lot of research on the development and implementation of CPAs within an ambulatory care setting, we could not find much within specialty pharmacies. So knowing that they're occurring in health system specialty pharmacies, we really wanted to showcase what is being done in this area. So our study was a single center retrospective cohort analysis of data collected from our electronic health record. I think it's also important to mention that this project had 2 arms. So one arm was looking at represcribing metrics within our clinics, comparing pharmacists and other providers, and that will be presented at the ASHP summer meeting. And then the objective of this arm was to look at the uptake and outcomes of CPA implementation in the integrated health system specialty pharmacy. So we evaluated Vanderbilt Specialty Pharmacy integrated clinics with a newly implemented CPA from September 2021 to June 2022 for 6 months of follow-up from the date of implementation. So this figure on the right, little timeline, shows the clinics at Vanderbilt with the CPAs when they were implemented. So multiple sclerosis was our first clinic in September of 2021, and then cystic fibrosis was the last clinic included in our analysis in June of 2022. But we retrospectively assessed that 6 months of data from these clinics shown in the figure, and we utilized a dashboard that tracked patient encounters, and we defined a patient encounter as a documented patient contact, a prescription order, a laboratory order, and anything that's on our quarterly audit safety concerns. We then analyzed this dashboard using descriptive statistics. And this figure shows the number of patient encounters 6 months post-implementation by each clinic. So overall, as you can see, the multiple sclerosis and cystic fibrosis clinics saw the most patients, which shows that there was likely more of a need for a pharmacist in these specific clinics with higher numbers of patient encounters. You can also see in this figure that the number of patient encounters was fairly consistent over that 6-month range that we analyzed post-implementation. And this figure shows the number of prescription and lab orders by each clinic. So once again, multiple sclerosis, cystic fibrosis, and then movement disorders clinics ordered the most prescriptions, and the multiple sclerosis clinic by far ordered the most labs. And that's partially due to the nature of the medications prescribed in that clinic, since they require frequent monitoring. And we also see variations in medication and lab ordering based off of how the clinic functions. So in some clinics, like the cystic fibrosis clinic, pharmacists round with other providers. So therefore, the providers end up putting in lab orders more often versus the pharmacist. And it's also important to mention that some clinics do not have lab ordering within the scope of their CPA, which is why we see a little bit of differing numbers in our data. And finally, the table on the left shows the most common types of lab orders in each clinic. So for adult hepatology, their most ordered lab was a quantitative hepatitis C PCR. For viral hepatitis and infectious disease, their most common lab was a CMP. And for the MS and neuroimmunology clinic, their most common labs was a CBC with differential. So finally, the figure on the right is also really important to mention. This shows the medication list and allergy review compliance on our quarterly audits. And this was at 95% or above in all of the clinics that we assessed. So given these findings, our conclusions are that pharmacists in a collaborative practice agreement in an integrated health system specialty pharmacy can help contribute to the number of patients cared for, number of medication and lab orders, and also help maintain a high medication and allergy list review compliance. Implementing collaborative practice agreements can allow for more patients to be cared for, as well as lower providers' workloads and expand pharmacists' responsibilities in the patient care process. And before I wrap up, I just wanted to say thank you to all of my co-authors, so Chelsea Renfro, Autumn Zuckerman, Amy Mitchell, and Bridget Lynch for their help on this project. Also, thank you to the AMCP Foundation and our sponsors. And my contact is up there on the screen.
Well, thanks, Ailsa. This was definitely, I think, timely research too, just because a lot of the disease states or condition-specific areas that you looked at, I would say continue to have either more medication treatments available in those particular categories or expanding in terms of their use as well. So definitely very timely and interesting too from the standpoint of the integrated healthcare delivery side and the specialty pharmacies associated there. So thanks again for going through your research and providing that to us. So as we think back to those 4 pillars that we talk about as it relates to the research agenda and kind of those pillars, priorities, kind of which one do you fall into? And I think we're probably giving away on this slide a little bit, but if you can tell us which one it falls into and kind of give a brief understanding for the audience why.
Yeah, so this research really fits into that 4th pillar, the impact of direct patient care services provided by managed care pharmacy on patient outcomes. So through this research, we saw that through collaborative practice agreements, pharmacists can aid providers in direct patient care services. And what we saw in our research is that we're seeing an increase in number of patients that we can care for by having these pharmacists in the clinic and doing orders and doing things that we'd typically think a provider would do. So this also, I think, is important to mention that we looked at these specialty clinics that have really niche areas and niche medications. And so pharmacists, I think, have a unique knowledge about these medications that we can really apply and use in these areas to help better patient care.
Well, thanks, Elsa. That was really good information. So if you don't mind, I do have a couple questions for you. I think just to kind of help the audience kind of get to know your research and you as well a little bit better. So obviously, like we talked about, a good topic, especially around specialty medication, specialty pharmacy, integrated delivery systems and the like. So as you kind of think back, why did you focus on this particular research, or what was it about this research that you did that was definitely intriguing for you?
Yeah, so kind of like I touched on the presentation, I think this is something that we don't really have a lot of research on. And especially in Tennessee, I know collaborative practice agreements have been gaining a lot of traction, and then there's a lot of attention on them. So I think it's something that's going to continue to grow within pharmacy. And so I did this project within the Vanderbilt Specialty Pharmacy Research Program. So they are fantastic and working on different research initiatives. So this was a part of one of their initiatives. And I've kind of been involved in managed care for just about a year and a half now. So I work at Blue Cross Blue Shield of Tennessee. So through this program, I was lucky enough to be able to get involved into a managed care kind of project.
Great. So I'm sure there was some learnings along the way. I don't think I've been a part of any research where you didn't learn quite a bit as you go through it. But I'm sure of those many things, if you could just pick maybe one of the top one or two pieces that, one of the big learnings you had through the process of the research you did.
Yeah, so I've been involved in research a few times before, but the depth of this research was really at a different level. So we, through our team, had to work through around 600 patient charts, which was very time consuming. So I think it was interesting for me to see a research project that took this much time versus some other projects, you look through less patients, but this was very in-depth, and it took quite a long time. So it was interesting to see the different types of research.
Yeah, definitely depending on the source of your data too can make it a little more challenging or a little easier depending on which one.
Mm-hmm.
So, as you've done some research before. Obviously, there was a first time doing the research and stuff like that. So if you kind of think back to that time and all the experience that you've had going through this, other researchers or others that don't know they want to be part of research and want to get into it, do you have any advice or anything that you would give, whether they're a student, newly graduated, or someone that's been practicing clinically for years? What advice do you think you would give to those getting into research?
Yeah, I mean, take that jump, take that leap of faith. Like this was something that I never would have thought I would have been able to be involved in, let alone win an award. So really, I think take that leap no matter what the topic is. I think no matter what, you're going to learn something and it'll be valuable for your career in the future.
Great. Elsa, thank you very much for taking time out of, I'm sure, a busy schedule to kind of sit down and go through your research. And again, congratulations on your research and for winning Best Poster at the most recent meeting. So congratulations.
Thank you.
So I want to thank everyone for joining and listening today. And if you want more information on the AMCP Foundation Best Poster Competition, the Joint Research Committee, and poster presentation resources, you can visit the AMCP Foundation website, and a lot of those are listed here on the screen for you today. Finally, I do want to announce and make sure that everyone is aware that there is a new AMCP Collaborate community that is now live. So the managed care research community is designed to facilitate the exchange of ideas, information, and also encourage in-depth discussions related to managed care research. So please join today and engage in the innovative and thought-provoking research discussions. Again, I did want to take the time to once again thank CVS Health for their partnership in supporting the Best Poster competition. So with that, I want to thank everyone for joining today. Ailsa, thanks again for joining us today, and have a great day, everyone.